Imagine this. You're 68 years old, sitting in your favorite chair after dinner. The TV is on, and you're feeling relaxed. Suddenly, there's a strange, heavy pressure in your chest. It doesn't feel like ordinary heartburn. It feels deeper, more uncomfortable. The discomfort begins to spread into your left arm, and now it's reaching up toward your jaw. Your forehead starts to sweat, your breathing feels short, and panic sets in. Am I having a heart attack? Now, picture this. There's nobody else in the house. No spouse, no kids visiting, no neighbor dropping by. Just you alone. In those terrifying moments, what you do next can mean the difference between life and death. Here's the reality. According to the American Heart Association, someone in the US suffers a heart attack every 40 seconds. And for seniors over 60, the risk is even higher. What's more alarming is that many of these heart attacks happen when a person is alone, at home, in the garden, or even while asleep. Too often, people ignore the symptoms or hope they'll just pass. But the truth is, every single second matters. The sooner you act, the better your chances of survival. The good news? You don't need to be a doctor, and you don't need fancy equipment to save your own life. What you do need is knowledge. In this video, I'm going to share 7 must-know survival tips for seniors over 60 who find themselves facing a heart attack alone. These tips are practical, they're straightforward, and they've been proven to make a real difference. By the end of this video, you'll know exactly what to do if this nightmare scenario ever happens to you, or to someone you love. So grab a notebook, because this may be one of the most important videos you ever watch. Hi, welcome back to Golden Sage Advice for Seniors and Elders. On this channel, we talk about senior health, fitness, and wellness with one simple goal: helping you stay strong, independent, and safe as you age. Now, I want to be clear, I'm not here to scare you. I'm here to prepare you. When it comes to heart attacks, knowledge is power. The more you understand what's happening in your body and how to respond, the greater your chances of surviving, even if you're alone. Here's why you should stick with me until the end of this video. I'm going to share 7 practical, easy-to-remember tips that can make all the difference in an emergency. These aren't complicated medical procedures. They're things you can do right now, at home, with no special equipment. And if you're watching this and thinking, well, I feel fine, I don't need this, I encourage you to keep watching anyway. Heart attacks often strike without warning, even in people who appear healthy. Preparing ahead of time is like carrying an umbrella. You don't wait for the storm to buy one. So, let's dive in and start with the first life-saving step. Before we get into the 7 tips, let me share 2 stories that show just how much difference your response can make. The first story is about Robert, a 72-year-old retiree. Robert was active. He enjoyed his morning walks and loved tending to his small vegetable garden. One evening after dinner, he felt a heavy pressure in his chest. At first, he thought it was indigestion. He tried to brush it off, telling himself it would pass. He even poured himself a glass of water and sat back down to watch TV. But the pressure didn't go away. It grew worse. The discomfort spread into his left arm and up into his jaw. Robert told himself, maybe I just need to lie down for a while. By the time a neighbor came to check on him hours later, Robert was unresponsive. He hadn't called 911. He hadn't taken aspirin. He hadn't given himself a fighting chance. Sadly, his story ended the way far too many do. Now let's look at Maria's story. Maria is 67, widowed, and also living alone. One spring afternoon, while pulling weeds in her garden, she felt an unusual heaviness in her chest. She remembered learning that chest pressure can be a sign of a heart attack. Instead of ignoring it, Maria went inside, called 911 immediately, chewed an aspirin she kept in her kitchen cabinet, and sat upright in her chair while focusing on steady breathing. Paramedics arrived within 12 minutes. By the time she reached the hospital, doctors were able to treat her quickly, and Maria survived with minimal damage to her heart. Today, she shares her story with other seniors to remind them how important it is to act fast. These two examples highlight a powerful truth. When you're over 60 and alone, survival during a heart attack doesn't just depend on luck. It depends on what you do in the first 5 to 10 minutes. So now, let's talk about exactly what you should do. These are 7 must-know survival tips that every senior needs to understand and practice. And I'll tell you right now, tip number 7 is something most people never think about, but it can be the difference between life and death. The very first step in surviving a heart attack alone is simple, but it's where most people make a dangerous mistake: recognizing the early warning signs. Now, the problem is that heart attacks don't always look like what we see in the movies. It's not always a dramatic collapse to the floor, clutching the chest in agony. In reality, the signs are often subtle, and that's what makes them so deadly. Here are the most common symptoms seniors should watch for: a feeling of pressure, tightness, or heaviness in the chest, pain that spreads to your arms, shoulders, neck, jaw, or back, sudden shortness of breath, even when you're not exerting yourself, breaking out into a cold sweat, lightheadedness or dizziness, nausea, or an unsettled stomach. Notice how these could easily be mistaken for something else, like heartburn, indigestion, or even the flu. That's why so many people ignore them. But here's the truth. If you're over 60 and you feel these symptoms, especially chest pressure that doesn't go away after a few minutes, you must treat it as an emergency until proven otherwise. Let me give you a quick example. John, 65, was walking his dog when he felt what he thought was heartburn. He decided to ignore it, but within half an hour, he collapsed. Compare that to Susan, 70, who experienced similar chest heaviness while folding laundry. Instead of brushing it off, she called 911 immediately. That decision saved her life. Here's a sobering fact. Studies show that nearly half of seniors wait more than 2 hours after symptoms start before calling for help. 2 hours. And in those 2 hours, precious heart muscle is dying. So, I want you to ask yourself, have you ever had chest pain or strange discomfort and thought, "It's nothing, I'll wait it out"? If you have, let me know in the comments. Your experience could help someone else realize the danger of ignoring the signs. Remember this simple rule: if it feels unusual, severe, or persistent, don't guess. Treat it as a heart attack until proven otherwise. Recognizing the signs is your first and most important weapon. The second step is the one that can literally double your chances of survival: calling emergency services right away. Here's what often happens. A senior feels chest discomfort, suspects something might be wrong, but they hesitate. Maybe they don't want to bother anyone. Maybe they think, "It's probably nothing, I'll wait and see." Or worse, they decide to drive themselves to the hospital. That hesitation can be deadly. Here's why. When you dial 911, you're not just calling for a ride. You're calling for treatment to begin immediately. Paramedics are trained to deliver life-saving care the moment they arrive. They can give oxygen, perform an ECG to confirm what's happening, administer clot-busting medications, and even shock the heart back into rhythm if it stops. If you try to drive yourself, not only are you risking collapsing behind the wheel, but you're also delaying the start of professional treatment. Studies show that survival rates are nearly twice as high for people who call emergency services compared to those who wait or attempt to drive themselves. Let's go back to our earlier examples. Robert felt chest pain but didn't call. By the time help arrived hours later, it was too late. Maria, on the other hand, didn't hesitate. She called 911 the moment she recognized something was wrong. That one phone call gave her paramedics on the way, instructions on what to do while waiting, and a much higher chance of survival. Here's a quick myth-busting moment. Myth: if the pain goes away after a few minutes, it's not serious. Truth: heart attack pain can come and go in waves. Even if it eases, the damage could still be happening inside your heart. Always call first. Asterisk, so here's what I want you to do right now. Pick up your phone. Look at the emergency number in your country, whether it's 911 in the US, 999 in the UK, or 112 in many parts of Europe, and save it as a speed dial on your home screen. Make it as easy as possible to call without hesitation. And let me ask you, be honest, if you felt chest pain tonight, would you call right away or would you wait? Drop your answer in the comments. I want to see how many of us are truly prepared to take action. Now, here's a simple action that can dramatically improve your chances of survival. If you suspect you're having a heart attack and your doctor hasn't told you to avoid it, take an aspirin. But there's a right way and a wrong way to do this. The correct method is to chew one regular aspirin, 325 milligrams, slowly before swallowing. Chewing allows it to enter your bloodstream faster compared to swallowing it whole. Why does this matter? Because aspirin helps thin your blood. It slows down the growth of the clot that's blocking blood flow to your heart, buying you precious time until paramedics arrive. Let me give you some perspective. Clinical studies have shown that chewing an aspirin during a heart attack can reduce the risk of dying by up to 23%. That's not a small number. That's the difference between life and death for thousands of people every year. Now, here's a practical scenario. Imagine it's 2 a.m. and you feel that crushing chest pressure. You remember this tip, but your aspirin bottle is in the kitchen, tucked away in a cabinet behind the cereal boxes. Do you really want to waste valuable minutes stumbling around, trying to find it? Of course not. That's why preparation is so important. Keep aspirin in at least 3 places by your bedside, in the kitchen or dining area where you often sit, and in your purse or pocket if you go out. That way, no matter where you are when the symptoms hit, you won't lose time. Now let me clear up a common myth. Myth: you should only take aspirin if the pain is unbearable. Truth: you should take aspirin at the first suspicion of a heart attack, not when it becomes unbearable. Waiting until you collapse means it's too late. So here's my challenge for you. After watching this video, go place aspirin in at least one spot where you'll remember it. Even better, tell a family member or neighbor where you keep it, so they can find it quickly if you can't. And let me ask you, do you already keep aspirin at home? If yes, where? Let us know in the comments. Your tip might give another senior the idea they need to save their own life. Tip number 4, stay calm and sit upright. When you're having a heart attack, it's natural to feel terrified. Your heart is racing, your chest hurts, and your mind is screaming. Something is very wrong. But here's the thing, panic makes everything worse. When you panic, your body releases stress hormones like adrenaline. This makes your heart beat faster and harder. Exactly what you don't want when your heart is already struggling for oxygen. That extra strain can turn a bad situation into a deadly one. So what should you do instead? The best thing is to stay as calm as possible and put your body in a position that makes it easier for your heart and lungs to do their job. That means sitting upright. Here's why. Lying down completely flat can make breathing harder and increase pressure on your chest. Standing or pacing around can make you lightheaded and cause you to collapse. Sitting upright in a sturdy chair, or even on the edge of your bed, keeps your airway open, makes it easier to breathe, and reduces strain on the heart. Picture this. You're at the dining table and you feel chest pressure. Instead of jumping up or lying on the floor, pull out the chair, sit with your feet flat on the ground, your back supported, and your shoulders relaxed. That's the safest position while you wait for help. Now, let's do something together. Try this right now. Wherever you are, sit comfortably, feet flat on the ground, and take a slow breath in through your nose. Hold it gently for a second. Now exhale slowly through your mouth. Let's do that again. Inhale, hold. Exhale. Feel that. Your heartbeat slows, your mind calms, and your body relaxes. This simple breathing technique can keep you steady while help is on the way. Here's another myth-busting moment. Myth: if I move around, I'll feel better. Truth: movement only increases the demand on your heart. The less you move, the better. So remember, when in doubt, sit, breathe, and stay calm. This one step can prevent your condition from spiraling while you wait for emergency services. And I'd love to know, have you ever tried slow breathing to calm yourself during stress? Let me know in the comments. You might inspire someone else to practice it before they need it most. Tip number 5. Loosen clothing and stay accessible. Now, this step might sound small, but it can make a big difference. Loosen any tight clothing and position yourself somewhere accessible. Why? Because when you're having a heart attack, your body is already struggling for oxygen. Tight collars, belts, bras, or even shoes can make you feel more restricted and uncomfortable. By loosening them, you give your body the easiest chance to breathe and relax while you wait for help. But there's another side to this: accessibility. Paramedics need to reach you quickly. If you collapse in a locked bathroom, a basement, or a bedroom at the back of the house, they'll lose valuable minutes trying to find you and break through doors. And in a heart attack, every minute matters. Here's a real-world example. A 74-year-old woman in Florida called 911 but collapsed in her bathroom. Paramedics couldn't reach her quickly because the door was locked and her house keys weren't available. They lost almost 15 minutes breaking in. By the time they got to her, her condition had worsened. Compare that to a man in Texas, age 69, who also called 911 but stayed in his living room near the front door. Paramedics were able to reach him immediately and begin treatment. That small decision gave him a much better outcome. So what can you do? After calling 911, sit in a visible, accessible spot, like a chair near the front door or main hallway. If possible, unlock the door for paramedics so they can get in quickly. Loosen collars, ties, belts, or anything restrictive. Keep a spare key with a trusted neighbor or in a lockbox outside. And here's a bonus hack for those who live alone. Consider a medical alert device or smartwatch with SOS features. With one press of a button, you can call for help, even if your phone isn't nearby. Here's a myth I want to clear up. Myth: if I'm already waiting for help, where I sit doesn't matter. Truth: your location and accessibility can shave precious minutes off the response time. And in a heart attack, minutes are life. So my question for you is this: if you had to call 911 tonight, where in your house would you sit so paramedics could reach you fastest? Think about it and share your answer in the comments. You may give someone else an idea that saves their life. Tip number 6. Know about cough CPR, but use with caution. This next point is one you may have heard floating around, especially in chain emails or social media posts, something called cough CPR. Now, I want to be very clear here. This is not a replacement for professional CPR or emergency treatment, but it's good to understand what it is and why it's sometimes mentioned. So what exactly is cough CPR? In very specific situations, like when the heart goes into a certain abnormal rhythm, a person may be able to keep blood flowing to their brain for a few extra moments by taking deep breaths and coughing forcefully, about every 1 to 2 seconds. The idea is that the cough acts almost like a pump, keeping some circulation going until help arrives. Sounds simple, right? Here's the problem. It only works in very rare cases, and usually only in a hospital setting where someone is already being monitored by doctors. Outside of that environment, it's unreliable, and it could even confuse people into thinking they're safe when they're not. Let me give you an example. A man in his 60s was undergoing a heart test in a hospital when his heart suddenly went into an abnormal rhythm. Doctors told him to cough repeatedly while they prepared a defibrillator. Those coughs kept his blood pressure stable for a short while, and he stayed conscious long enough for treatment. But that worked only because he was surrounded by medical staff and equipment. If you're at home alone and you suddenly collapse, cough CPR is not a guaranteed solution. It might help for a few seconds if you're about to faint, but it is no substitute for calling 911 and following the other steps we've already talked about. So here's the bottom line. Call 911 immediately. That's the true lifesaver. Chew aspirin if it's safe for you. Sit calmly and breathe. And if you feel yourself fading and can't stay conscious, strong coughing may buy you a few more seconds until help arrives. But don't rely on it as your primary plan. Now let me ask you, before this video, had you ever heard of cough CPR? If yes, where did you hear about it? And did you think it was a real solution? Let's clear up the myths together in the comments. Tip number 7. Prepare beforehand. Now we've come to perhaps the most important tip of all, the one that can save your life before a heart attack even happens. And that's preparation. Here's the truth. In an emergency, your brain doesn't always think clearly. Panic sets in, your body is in pain, and remembering details becomes difficult. That's why preparing ahead of time is so powerful. It removes the guesswork and gives you a plan. So what does preparation look like? Let me break it down. 1. Keep a medical information card. Write down your name, age, medical conditions, medications, allergies, and your doctor's contact information. Keep it in your wallet, by your bedside, and on the fridge. Why? Because when paramedics arrive, they'll have everything they need to make fast, accurate decisions. No scrambling, no guessing. Example, a senior in Ohio had a card listing her blood thinner medication. Paramedics saw it right away and adjusted their treatment instantly, saving her from dangerous complications. Post emergency numbers in easy-to-see places, large print by the phone. A sticky note on the fridge. Even programmed as IC, in case of emergency, in your mobile phone contacts. When every second matters, you don't want to be squinting at tiny numbers or fumbling with your phone. 3. Share your health information with a trusted person, a neighbor, a family member, or even a friend who checks in regularly. Make sure they know about your heart condition, your medications, and where you keep your aspirin. Example, one of my viewers told me her neighbor saved her life because he already knew she had a heart condition. When she called him in distress, he immediately gave paramedics the information they needed. 4. Arrange easy access for paramedics. Keep a spare key with a trusted neighbor. Consider a lockbox outside your house with a code. If you live in an apartment building, let your doorman or security staff know about your condition. Why? Because locked doors waste time, and in a heart attack, time is muscle. 5. Prepare your home for safety. Keep aspirin in at least 3 locations: by your bed, in the kitchen, and in a bag or pocket when you go out. If possible, have a phone or medical alert device within reach of your most used spaces. Falls and collapses often happen far from a landline. 6. Practice the plan. Preparation isn't just about having things written down, it's about practicing. Pick up the phone and say the words, "I think I'm having a heart attack." Unlock the front door. Sit in the chair you'd use while waiting. These small rehearsals make it second nature, so you won't freeze in the moment. Now let me clear up a myth here. Myth: I'll figure it out if it happens. Truth: in a crisis, you may not have the strength or clarity to figure it out. Preparation is what carries you through when your mind and body are overwhelmed. So here's my challenge for you. After this video, spend 10 minutes preparing. Write a medication card. Place aspirin in easy spots. Talk to your neighbor. These small actions may one day make the difference between survival and tragedy. And I'd love to know, what's one preparation step you already have in place? Or what's one you're going to start today? Share in the comments. Your preparation might inspire someone else to do the same. So, Let's take a breath and quickly review the 7 must-know tips that could save your life if you ever face a heart attack alone after 60. Recognize the warning signs: chest pressure, pain, shortness of breath, dizziness, nausea. Don't ignore them. Call emergency services immediately, 911 or your local number. Never wait, never drive yourself. Chew an aspirin if your doctor allows it. Keep it in easy-to-reach places. Stay calm and sit upright. Breathe slowly, steady yourself, and reduce strain on your heart. Loosen tight clothing and stay accessible. Unlock the door. Sit where paramedics can find you quickly. Know about cough CPR, but with caution. It's not a cure, just a rare last resort. Prepare before it happens. Medication lists, emergency numbers, spare keys, and a plan you've practiced. Each of these steps is simple. Each one takes just a few moments. But together, they can literally be the difference between life and death. Here's the empowering truth. Surviving a heart attack alone isn't just about chance. It's about being prepared, knowing what to do, and acting fast. And the fact that you're watching this video right now means you're already ahead. You're equipping yourself with knowledge that could save your life or the life of someone you love. So don't be afraid. Be prepared. And remember, every second counts, but so does every choice you make. If you found this video helpful, please take a second right now to give it a thumbs up. That helps this message reach more seniors who need it. And don't forget to hit the subscribe button and ring the bell, so you'll always know when I post new health and safety tips just for you. Now, I'd love to hear from you in the comments. Which of these 7 tips surprised you the most? Or what's one step you're going to prepare today? Maybe keeping aspirin nearby or writing down your medical info. Your answer might inspire someone else who's reading. And here's something important. This video is just one piece of the puzzle. Heart attacks aren't the only emergency seniors need to be ready for. Another big one is strokes, and strokes can be just as life-threatening. That's why I strongly recommend you watch my next video, 5 early signs of a stroke seniors must never ignore. Knowing those signs could save your life too. Before we close, I want to remind you, this video is for educational purposes only. I'm not your doctor, and this does not replace professional medical advice. If you ever think you're having a heart attack or any medical emergency, call 911 or your local emergency number immediately. Always consult your healthcare provider about your personal health situation. Remember, knowledge prepares you, but professional care saves lives.